Good afternoon, everyone, and thank you for joining us for Pregnant in Time of a Crisis, Improving Black Maternal Health through Advocacy and Law. My name is Cherise Frazier, and I am the chair of the MBA Health Law section. And I am excited this afternoon to speak with this esteemed panel of African American women who's going to share with us their expertise and insight into this very important topic. And to just kick us off, I want to introduce our moderator who will be engaged in helping to facilitate the discussion today, Tammy Boyd, who's also a member of the NBA Health Law section. And Tammy is the Chief Policy Officer and Senior Counsel for Black Women's Health Imperative. She has an extensive experience in creating and executing federal legislative policy strategy and facilitating outreach to members of the United States House of Representatives and the Senate. And so Tammy's going to jump right in with her vast experience and help us to have this very important conversation. Thank you all for joining.
And thank you, Sharice. And so we're going to start off by hearing from Congresswoman Alma Adams. She was elected to the her fourth full term, representing the 12th Congressional District of North Carolina. Congresswoman Alma Adams serves as the co-founder and co-chair of the Black Maternal Health Caucus. Additionally, Representative Adams serves on the Committee on Financial Services and the Education and Labor Committee. She also serves as assistant whip for the Democratic Caucus. She is chairwoman of the Committee on Education and Labor, Subcommittee on Workforce Protections, and she's also the vice chairwoman of the Committee on Agriculture. And we will now see a video from Congresswoman Adams.
I'm Congresswoman Alma Adams, and I proudly represent the 12th Congressional District of North Carolina, home of the city of Charlotte and greater Mecklenburg County. I want to thank each and every one of you for taking time out to tune in to this important program. I'm going to speak briefly about Black maternal health, the Omnibus Act, and some of the work that I've been doing in Congress. Sadly, America is in the midst of a Black maternal health crisis where Black mothers are disproportionately and needlessly dying. Black women are nearly 3 times as likely as a white woman to die from pregnancy related complications. In some cities, that disparity between Black and white women can be as high as 8 times. And the CDC data tells us that 60% of these deaths are preventable. These statistics are unacceptable. And in the richest nation in the world, these disparities are simply reprehensible. And that's why I'm working hard to raise awareness among members of Congress. This year, members of Congress, state legislators, advocates from all over the country and the greater community came together for a powerful week of awareness, activism, and community building. We focused on deepening the national conversation about Black maternal health, amplifying community driven policy, research, and care solutions, centering the voices of Black mamas, women, families, and stakeholders, providing a national platform for Black led entities and efforts on maternal health, birth, and reproductive justice, and enhancing community organizing on Black maternal health. When we talk about the maternal mortality and morbidity crisis in America, we cannot begin to solve these inequities unless we consider the most marginalized and impacted people, and that's Black women and birthing persons. In 2018, I was honored to introduce the first congressional resolution recognizing Black Maternal Health Week with then Senator Kamala Harris. And it's been an honor to reintroduce the resolution each year since. In 2019, I asked the youngest Black woman elected to Congress if she wanted to launch a congressional caucus focused on Black maternal health, and Congresswoman Underwood did not hesitate. And so we launched the Black Maternal Health Caucus, which now boasts 115 bipartisan members of Congress. In 2020, we introduced the Black Maternal Health Momnibus Act, a package of 9 bills to comprehensively address existing gaps and policy solutions to the maternal health crisis. But most importantly, it was a bill that centered Black mamas using the reproductive justice and human rights frameworks as our guide. The bill was crafted with Black women, by Black women, and for Black women. This year, we reintroduced the Momnibus with 3 new bills, and I am so excited about passing it into law this Congress. Now more than ever, the pandemic has underscored the urgent need for everyone to have access to culturally competent and quality care. As Reverend Dr. Martin Luther King Jr. declared in 1966, of all of the forms of inequality, injustice in healthcare, he said, is the most shocking and the most inhumane. As many of you know, the U.S. is one of only 13 countries in the world where the rates of maternal mortality and morbidity are worse today than they were 25 years ago. And we continue to have the highest maternal mortality rate among affluent countries because of the disproportionate death rate of Black mothers. Research also suggests that the cumulative stress of racism and sexism undermines Black women's health, making them more vulnerable to complications that endanger their lives and the lives of their infants. To make matters worse, the significant health disparities that Black mothers and infants already face are further exacerbated by COVID 19. Black maternal health in the coronavirus era is truly a crisis within a crisis. For me, like countless others who are dedicated to this effort, this issue is deeply personal. This work began when my daughter Janelle almost became a victim of this crisis. A physician overlooked my daughter's complaints of pain in her abdomen, chose not to listen to her needs as a Black woman. The dismissal of her pain almost cost my daughter her life. Since the launch of the Black Maternal Health Caucus over the past 2 years, Congresswoman Underwood and I have talked about how these terrible inequities in our society and in our healthcare systems have stolen countless moms from their children. And for every mother lost, there's close to 100 near misses. And so when we think about how important mothers and grandmothers are to their communities, we should recognize that moms touch so many lives, even outside their immediate families. My daughter is not only the mommy to my 2 amazing grandchildren, but she's the principal to all of the students at Reedy Fork Elementary School. And so, as you can imagine, this issue is deeply personal for me to so many others. And although we have much work to do, we will not stop shining a bright light on the racial health disparities and the unacceptable outcomes that Black people continue to experience here in this great country. As I mentioned earlier, throughout the process of developing the Momnibus, we remain very intentional about centering the voices of Black women and ensuring Black women led organizations were consulted often. The Momnibus makes investments in social determinants of health, community based organizations, the growth and diversification of the perinatal workforce, improvements in data collection and quality measures, digital tools like telehealth, and innovative payment models. In addition to direct efforts to improve Black maternal health outcomes, the Momnibus focuses on high risk populations, including women veterans, incarcerated women, and Native Americans. It focuses on environmental justice because recent studies have reinforced the linkage between man made climate change and the toll it takes on pregnant women and their infants. The Momnibus provides critical funding for community based organizations to identify climate change related risks for pregnant and postpartum people and their infants, provide support to patients, and mitigate exposure to climate risks, especially in communities of color. Since the beginning of the COVID-19 pandemic, over 64,000 women that we know of have contracted the coronavirus while pregnant. According to two CDC morbidity and mortality weekly reports, we learned that pregnant women might be at increased risk for severe illness from COVID 19 and the potential risk for preterm birth. Furthermore, Hispanic or Black women were found to be disproportionately impacted. And that's why this year, our package specifically addresses this crisis within a crisis with new bills: the Maternal Health Pandemic Response Act and the Maternal Vaccination Act. Respectively, these bills make targeted investments to advance safe and respectful maternity care and improve data collection, surveillance, and research on maternal health outcomes during the pandemic and beyond, and provide funding for programs to increase maternal vaccination rates, protecting moms and babies. Finally, I want to take a moment to speak about the bill that I'm honored to lead in the package, the Kira Johnson Act. In 2016, Kira Johnson checked into a hospital with her husband to give birth to her second son, Langston. Kira, an entrepreneur, world traveler, mother of one healthy boy already, and a black woman, did not make it out of that hospital alive. She died from hours of neglect and severe hemorrhaging, nearly 12 hours after delivering Langston. Kira deserved better. Kira Johnson mattered. And it didn't have to be this way. However, Kira wasn't the last one. On April 17th of last year, 26-year-old Amber Isaac, a beautiful black mama, tweeted that she, and I quote, can't wait to write a tell all about my experience during my last two trimesters dealing with incompetent doctors at her hospital in the Bronx. On April 20th, her doctors induced labor and proceeded with an emergency C section. During the delivery, Amber's heart stopped as the medical staff removed her son, Elias. And due to the pandemic, the hospital did not allow Amber's partner to be in the room during the delivery, and he later learned that she had HELP syndrome, also known as preeclampsia. Little Elias was born more than a month early, but healthy. On April 21st, his mother, Amber, was gone. For Amber, for Kira, for all of the mamas we have lost to this crisis or have almost lost due to the errors and bias in care, we have to pass the Momnibus and Kira Johnson Act. This bill makes investments in community based organizations that are leading the charge to protect moms. It also supports the implementation of bias and anti racism training programs and the establishment of respectful maternal care compliance offices to address bias and racism. At its core, the Kira Johnson Act is all about accountability and empowering our community health partners who have been providing safe and culturally sensitive care to Black moms for years. For decades, the U.S. maternal mortality and morbidity rates have gotten worse for all mothers, but especially for Black women, whose health outcomes are further compounded by systemic and structural racism. Black mothers should not be dying during what should be one of the most joyous times of their lives. So it's absolutely critical that we provide mothers the support they need before, during, and after pregnancy. And that includes access to nutritious foods, mental and emotional health services, quality postpartum coverage extending for up to 1 year, safe housing, and a clean environment, including air and water. We need to ensure mothers have access to proper paid leave, and we need to see it as an investment in public health, not as a handout. Moreover, not only do we target failures in maternal health care, we propose solutions that are culturally competent, comprehensive, and effective. With the Momnibus, we've designed a roadmap to help our healthcare system, healthcare providers and regulators and lawmakers and society to finally make Black maternal and infant health a priority. But our work is not finished, and we won't be able to get the Momnibus passed in Congress without help. As advocates that are passionate about racial justice and healthcare justice, I encourage you to continue standing up, speaking up, and making your voices heard. And let us continue to empower ourselves, fight for a more just present and future, and demand the respect that our communities deserve. Thank you all for your commitment to do this work, and I will continue to fight alongside each of you to improve maternal health outcomes. Last but certainly not least, thank you for valuing Black bodies and Black lives. And let's not lose another Black woman, birthing person, or baby to this crisis. Thank you, and God bless.
Thank you. And again, we have a great lineup of a panel today. Again, I'm Tammy Boyd, Chief Policy Officer and Counsel for the Black Women's Health Imperative. And for many of you who may not know who Black Women's Health Imperative is, we are a national nonprofit organization dedicated to advancing health equity and social justice for Black women across the lifespan through policy, advocacy, education, research, and leadership development. And we identify the most pressing issues that affect the nation's 22 million Black women and girls. And reproductive health is one of our core issues. And we are also a part of the Black Maternal Health Caucus, the Congressional Black Maternal Health Caucus. And so today we have some amazing panelists. We have Dr. Joya Career Perry, who is the founder and president of the National Birth Equity Collaborative. We have Michelle Batchelor Goodwin, who is a lawyer, professor, and global thought leader. We have Lexi White, who is the government affairs and senior manager for In Our Own Voice, which is the National Black Women's Reproductive Justice Agenda. And we also have Kishelle Webster, who is a part of, with the Congresswoman Alma Adams' office and key in the drafting of the maternal monobus legislation. And so I can first start with each of you, just kind of give a little background about each of you. And we can start with you, Joya.
Well, thank you so much, Tammy. It's always a pleasure to be here with you. And this is actually my first time presenting to the National Bar Association. I was telling them I follow Tammy around to all kind of meetings, and this is the first time she's brought me to the lawyer meeting. So now you got to come to the with us to the NMA meeting, and then we'll be even. But anyway, so our organization, the National Birth Equity Collaborative, is 6 years old. We started with some funding from the W.K. Kellogg Foundation to focus actually on Black infant mortality, because although I'm almost a 50-year-old Black woman sitting in a almost 50-year-old Black woman's body, like many people, we ignore the health and the needs of Black women, and we focus only on the baby or the fetus. But luckily, about 6 months into our founding, we had the pleasure and the honor to be invited to the Mother House to a meeting that was being held with the Center for Reproductive Rights and Sister Song about the fact that the UN had sanctioned the United States for being the only industrialized nation where maternal mortality was increasing, and specifically that Black birthing people were dying at 3 to 4 times the rate of their white counterparts, despite income or education. So we added maternal to our mission and vision. which is important because the number one reason for infant mortality is premature birth, and the babies aren't coming early just because they want to come early. They're coming early because of racism, classism, and gender oppression. It also causes maternal mortality. So our organization works now through research. So we have a lot of work that we're doing through the Robert Wood Johnson Foundation with the American College of OBGYN and Johns Hopkins, looking at respectful maternity care. We also do a lot of policy and advocacy with our colleagues at Black Women's Health Imperative and also in our own voice and the Center for Reproductive Rights and Professor Goodwin at a state, local, and federal level. And we also do what we call, we do training. So we don't call them implicit bias trainings. We do birth equity trainings because it's not just your individual bias, but it's the structures that create those biases and looking at racism, classism, and gender oppression. And then lastly, we do a lot of talking, we call it culture shift. That's to media, conferences like this, podcasts, wherever we can get the message out that stop blaming and shaming Black birthing people around our outcomes and really undoing the harms and the root causes. So that's what we do. Thank you.
And Professor Goodwin.
It's a pleasure to be with you all. Today's program is where I get to be a fangirl, quite honestly, of everybody who's on the screen. So I'm a chancellor's professor at the University of California, Irvine, and a member of several faculties at the university, the School of Law, our Health Sciences department, Gender and Sexuality Studies, our Stem Cell Research Center, and a number of others that are in the humanities. And my work is at the intersections of law and medicine. I work within the sphere of constitutional law. I serve on the National Executive Committee of the American Civil Liberties Union. And I'm also the founding and managing director of the Center for Biotechnology and Global Health Policy at the University of California, Irvine. And I'll speak really quickly to two of our key initiatives, though we have a number of them. I want to speak to all of them, right? But we have one of our initiatives focuses on reproductive justice, and we founded the nation's second reproductive justice law clinic because when you think about all of the kinds of traumas that are happening to people's lives and how they intersect with mass incarceration, it turns out we're not training lawyers to address it at all. So we founded the second clinic in the entire country to actually focus on how policing intervenes in pregnancy and reproduction. But there's another sphere of this, which I think is also important in thinking about our work at the center as well, is that we've just launched a project that is looking at race and social determinants of health as well. So to bring even greater specificity to what this means in the lives of people of color, of Indigenous people, Black women, Latinx women, and so much more. And I'll just end it with just talking about last year, my book, Policing the Womb, came out. I'll talk a little bit about it today, but it was a 10-year process, much longer than what I anticipated. But that was a reflection of how bad things were year after year, that I couldn't just stitch it up and wrap it up because there were just other aggravating factors that undermined reproductive health care for birthing people in the United States. So I'll end it there. It's such a pleasure to be with you all.
Thank you. We're excited you're here today. Lexi White.
Good afternoon, everyone. I also feel as though I'm fangirling on this panel with so many wonderful leaders who I admire. I'm here today as a human rights advocate and senior manager of government affairs with In Our Own Voice, National Black Women's Reproductive Justice Agenda. We are a national and state partnership of 8 Black-led women's reproductive justice organizations across the country, whose work really centers the human rights framework and more specifically reproductive justice framework, which of course is not merely a critical framework, but is in real time a very real and growing interdisciplinary social change movement that asserts our human right to have full agency over our bodies and lives and over our decision-making around pregnancy and parenting. That includes our labor in terms of the work that we do and the ways that our labor is affirmed through equitable policies and protections in the workplace, but that also includes the emotional and caretaking labor that we as Black women uniquely perform over the courses of our lifetimes, and our labor in terms of the ways that we are able to access healthy birth options, care that supports healthy birth, and a range of supports around our reproductive health over the course of our lifetimes. So I look forward to diving deeper into this conversation today. And again, very happy to be here.
Thank you. And Kishelle Webster.
Thank you, Tammy, and good afternoon, everyone. Not to be a copycat, but like Lexi and Professor Goodwin, I too am fangirling here with so many amazing leaders, in this movement around reproductive justice and birth equity. I'm a former staffer with Congresswoman Adams' office as her senior policy advisor on healthcare and a few other policy issues. But worked closely with Congresswoman Adams to help launch the Black Maternal Health Caucus back in 2019. And it was really, the conception of it was in late 2018. And just to see how far that has come and to have leaders here on this call, on this forum, who have been really trusted stakeholders and trusted voices that we have relied on to build out the Black Maternal Health Momnibus Act. It really is an honor to be here with all of you. And I look forward to diving into this discussion as well today. So back to you, Tammy.
Thank you. So let's get started. This panel will really, again, delve into the historic and contemporary plights that Black birthing people, Black women face when seeking maternal care and its impact on the community. And so I'll start with you, Dr. Joya Creperi. So for the past 25 years, maternal mortality for the Black women, it has continued to rise. What are the ways in which the coronavirus pandemic highlighted birth inequities in the United States? And can you also speak to, I know you talk a lot about racism and how that the interplay in maternal health for Black women?
Yeah, I think the Congresswoman highlighted an important story in her opening remarks around Amber Rose Isaac. And it's an important really illustration of how the pandemic highlighted issues that already existed prior to the pandemic. So we knew prior to COVID-19 that Black birthing people, Black women, despite income or education, when we enter a healthcare facility, we're less likely to be believed, we're less likely to be listened to. So we show up having done all the things that meritocracy says we're supposed to do, right? So we are exercising, we're eating healthy, we're partnered, and we still are not listened to. And so what COVID showed us, and especially if you think about the case of Amber Rose Isaac, as she mentioned, is that even when she knew how to advocate for herself, even when she had the capacity and knew what language to say, she had family members who participated in the healthcare industry. So there's some words that we use that are like key words to get you better access. She knew those things, but the fragmentation of our healthcare system still didn't even allow for that to work. So she knew to say things like, I'm going to ask for a patient advocate. I can change providers and go to a different facility. I should have social support. So she had a lot of times the solutions when it comes to Black maternal health is telling us what we should do, what Black women should do, how we should advocate for ourselves, how we should fight for ourselves. That's historically been the solutions. She had all those solutions and she still died. And because when you don't have a structure and a community that values you, even when you fight for yourself and advocate for yourself, and COVID then highlighted how those fractures and those fragments cause you then to still die. So she had a low platelet count, which is something that can be innocuous. Your platelets cause your blood to clot. And that's important to have when if you have a baby, you could bleed to death. But it also could be a sign of other illnesses. So her advocating around that and not having access because we couldn't have in-person visits, you couldn't have social support. Doctors were using their own biases to decide who should come in and be seen in person or not. So, whenever we leave us doctors, I'm an OBGYN, when you leave us to our own devices, our biases are going to show up. So if you say we're in the middle of a pandemic, we have to pick and choose who needs to come in, the urgency of their care. We're never seen as urgent. We're never seen as the most needed or the most deserved. And that shows up in how we even create our healthcare systems. Most of us, so going back to the original conversation about racism, the father of modern gynecology, my field of obstetrics and gynecology, is J. Marion Sims, who was a plantation doctor. He practiced in the Deep South in Mobile, Alabama, on a plantation on 3 Black women who were enslaved, among others. But we know the 3 names really well: Lucy, Betsy, and Anarcha. And he would do multiple surgeries on them without any anesthesia. And he created, the transatlantic slave trade was over, but they still needed the economic engine of this country, which is Black women's uteruses. And so his job as a plantation doctor was to create an industry that allowed for Black women to create babies that can be utilized in industry. That same belief that our only role is to create babies to be utilized in industry shows up in almost all of the ways that we're treated inside of hospital systems, how we're policed inside of hospital systems, as Professor Goodwin mentioned, how we're policed in general, how we're over our bodies are not valued. Our one function is to produce workers for the fields and for industry. And that shows up every day in how we're devalued in our care, how we're devalued by our labor, and all the other things that my fellow colleagues on this panel mentioned.
Yes, and sort of to follow up, that's those are great points, Dr. Prairie. Can you talk a little bit about your work around when you talk about advocating to policymakers and key stakeholders? Can you talk a little bit about your initiative around the White House Office on Sexual and Reproductive Health, and exactly what is that, and how that will definitely help in terms of addressing many of these maternal health issues?
Well, so many of my panelists talked about this framework of this advocacy around reproductive justice, right? And I know this is a room full of lawyers. My sister's a lawyer. I love lawyers. Y'all love some rights. Y'all love some laws and some policies. But there was a right to own us. There was a right to enslave us. There was a right to murder us. So I'm not the reproductive rights advocate. I have to tell you, I need some justice up in here. I need y'all to have what is the orientation under which these rights and policies are being built. So when we think about the fact that there was a right to do all those things codified at the highest level of government, right? Segregation, eugenics, even family planning, the belief that your job is to plan better. We put money so much in planning instead of well-being and your wellness. So what we want is to undo that harm of generations of devaluation from the highest level of government that codified a belief in a hierarchy of human value based upon gender, based upon skin color, based upon class, to undo that harm, to say, our job is not population control, our job is not to police you, our job is to really support you, to have well-being. What would it look like for the highest level of government to say, our job is not to say, we tie climate change to the uteruses of Black and brown people in India and Nigeria, right? That's our current strategy, right? So how do we undo that injustice and have reproductive justice at the White House? So we have asked for during the Biden-Harris administration to really codify and undo the harm of eugenics and family planning with the White House Office of Sexual and Reproductive Health and Wellbeing, that we know that your reproductive organs are not just used for reproducing. Many people are childless by choice, or we don't even invest in infertility options. I mean, I've traveled to other countries. Every other high-income nation covers in vitro fertilization on public insurance. We can't even get private insurance. We can't even get employer-sponsored insurance in the United States to cover it. So this idea of undoing this harm of a belief of the rich, the survival of the fittest, and those who have wealth or should have access to things, and the rest of us are not deserved. We have to undo it at this highest level. So this sign-on letter, we have over 150 organizations, including In Our Own Voice and including Black Women's Health Imperative, who are supportive of this initiative, as well as everybody from international orgs to Black breastfeeding orgs to people who work on abortion and contraception. The wide range can see themselves in this understanding of reframing the conversation around sex and reproduction away from family planning and population control to one of well-being, to one of investment in us as human beings, to one in undoing the harms that have been codified into law. This is not about personal choice. So many times we do anti-racism trainings and people are like, well, that's just people's taste. They do that way because it's their individual taste and behaviors. Well, people with power were able to create their tastes and behaviors into policy, into law that is still codified today. So to undo that, we need an office at the highest level of work across all the agencies. So it's not just a health issue, it's a transportation issue, it's a HUD issue, it's everywhere. We have criminalized the bodies of Black birthing people across the spectrum. And you can see that when you talk about the policies, the opportunity we have because we have a White House with Biden and Harris, and we have a Democratic Congress. Why can't we invest in justice and joy? This is our time. This is our time. We are old. Black women are owed an opportunity to be invested in. And so that's what I'm asking, to be invested in.
Thank you. And sort of to pick up on that, Professor Goodwin, to really level set the audience in terms of the legal aspect, into the National Bar Association, in your recent book, Policing the Womb, Inside Invisible Women and the Criminalization of Motherhood. We've heard some of your podcasts, which are awesome. And can you talk a little bit about your book, which provides an account of criminalization of all aspects of reproduction, pregnancy, abortion, birth, motherhood, in the U.S. Can you provide some highlights and talk to us a little bit about the legal construct?
Yeah, well, thank you so much for that. I think it's really important to go to the historical foundations, just as Dr. Kurpuri was just speaking about vis-a-vis Marion Sims. So if you think about it from this nation's very origins, it was about capitalizing off of Black women's reproduction and making sure that the children who were the offspring of those women would always be enslaved. So the earliest US laws were about that. So when these questions today about, oh, can you show us systemic racism? What does that look like? Well, systemic racism is actually changing a system where prior to that, offspring took the status of their fathers, with offspring taking the status of their mothers, also introduced then rape and sexual assault to the panoply of the horrors and terrors that Black women experienced. So keeping in mind the legalization that had taken place of kidnapping, of trafficking, of sex trafficking as being part of the origin of the United States story and its capitalist story, right? Like that's part of its roots, and that's really important to understand. And so as we think today about the kinds of traumas being experienced within the reproductive space, we must remember that Black women were the canaries in the coal mine then and even today. So if you think about it, if one were to think, let's say, about abortion, which has come up in many ways today, as in a, not just in this conversation, but as a kind of political conversation. But abortion was legal in the United States. It only became criminalized around the time of the Civil War. And it's really interesting because it is a coming together of a kind of perfect storm in many different ways, right? There were doctors like Horatio Storer, Joseph D. Lee, these individuals who were anti midwifery, right? But it's important to note that the majority of the midwives at that time were Black women. And the ways in which they wrote about these women and that these women were engaged in horrific practices, it needed to be criminalized. But what they were really engaging in was a white supremacy kind of project, because if you read deeper about what the things were that they were writing about, it was anti-immigration kind of work. Abortion became this kind of useful tool, if you will, in order to demonize and stereotype the people who were doing midwifery work and to make sure that they would no longer be able to engage in their profession. Let me just say that in their writings, what you can find is that they talked about how important it was for white women to go and spread their loins south and west and north, right? And it's this sort of coming fear of the browning of the United States. But what this means and what I talk about in my book is the kind of complicity of the medical profession now in what we see in terms of these contemporary iterations. So let me just make a couple of points. We see slavery, but it's important to also understand the enterprise of Jim Crow in all of this, right? To understand the United States practice of eugenics. 1927, the Supreme Court in Buck v. Bell legalizing eugenics, the forced compulsory sterilization of people. And I think that's really important to understand the kind of euphemistic, like football of, of Black women's reproduction, right? What Fannie Lou Hamer called the Mississippi appendectomy being imposed upon children as young as 10 and 11 years old, who were Black, who were being forcibly and coercively sterilized in the United States. And then what it means today, in terms of the intersecting of mass incarceration and reproduction, resulting in the 1980s and 90s with Black women being dragged out of hospitals in bloodied gowns, being placed in police cars, giving birth in prison toilets and on concrete floors because their doctors were releasing confidential patient information. Well, that's occurring today too. And so the book addresses those instances, of Black women being charged with murder for having stillbirth, being charged after having miscarriage, things like that, are women being, policed and followed after slipping downstairs in their homes or, refusing to have a C-section. And so the book addresses those kinds of issues and more. And one point, and I'll make it as I close on this question, which is that law is stagnant. In our first year law classes, we're teaching cases that are back from the 1600s, 1700s, and they're taught today. But what is very interesting is the area in which law is being innovative happens to be in this space, right? So everything else is old, but once you start looking at reproduction, it's all a whole lot of new in a lot of different ways. And between 2010 and 2013, there were more of these laws that were kind of like anti-privacy, autonomy, people controlling their own bodies than in the 30 years prior combined. That gives us a sense of all of this.
Absolutely. And could you elaborate? You mentioned a little as you were talking, but could you elaborate a little more? Because you also get into the fiduciary duty of physicians and what nurses owe to patients. I mean, would you
Yes.
elaborate on the duty of
I'm
care?
happy to. And in fact, one of the things I start off one of the chapters, and actually when I read from this chapter, I still get emotional about this particular chapter where I talk about Barbara Dawson. I have a couple of chapters that sort of deal within these spaces and doctors explicitly violating what have been sacrosanct both legal understandings and ethical understandings when it comes to Black women. But to really help drive home the point, I start off one of my chapters with talking about Barbara Dawson, and it's the chapter called Changing Role of Doctors and Nurses, Hospital Snitches and Police Informants, right? How doctors and nurses have become basically deputized in the criminal space. But Barbara Dawson was actually a grandmother. So she wasn't going to the hospital for any reproductive means, but I think it helps to give us a sense about what Black women are enduring. And this is before George Floyd, a Black woman who says that she can't breathe. She calls up calls up 911, it's then an ambulance, no criminal record, going to a hospital. How does she die then outside of a police squad car? And I talk about presenting the case of Barbara Dawson in Paris at a conference, and how Miss Dawson, in the images when you see her, she looks like anybody's Southern Black grandma. Hat crest to the side, that kind of look of no foolishness for nobody, and looking like she's ready for church. And she goes to the hospital complaining that she can't breathe. Can't breathe. The hospital called the police on her because they're ready for this Black woman to be gone. And this Black woman is insisting she needs care. But in the American medical system, a Black woman saying she can't breathe, turns out it can mean very little to a hospital. And so they call the police on Miss Dawson as she's saying she can't breathe. And they say she's trespassing, which you can't make up. That a patient who's saying she can't breathe is now trespassing because she is insisting upon care. The police come and she has oxygen that they've been giving her, but the police see their duty as removing her from the hospital from trespassing. And it's the hospital staff that help them remove her oxygen, pointing to the officer saying, well, you can disconnect it from the port in the wall, which they do. And in the police report and on the lapel audio, you hear it all. You hear Miss Dawson crying out, you can't do that. You can't do that. I cannot breathe. And then you hear the officer very calm. And in my classes, when I've played this audio and video, sometimes my students are confused because the officer sounds so calm and they say, Miss Dawson sounds loud, like she must be okay. And she's begging. There's a point when she's begging, you can't do this. You can't do this. Oh my God, you cannot do this. And the police report describes how they then, a hospital staff member and police handcuff her, putting her hands behind her back, and the officer in his report describes how he pushes her out the door. Miss Dawson collapses within feet of that by the police car. And then again, you hear on the audio where the officer is saying, you got to get up. You just don't want to go to jail. And you hear her relative saying, she can't breathe. She's not faking it. And you hear another officer saying, she's just faking it. She just doesn't want to go to jail. And you must ask, why should Miss Dawson be going to jail? She is a Black woman who said she cannot breathe and she needs help. It turned out she had a blood clot in her lungs. And I think that story really helps to illustrate this kind of intersecting of what Dr. Joy Prairie talked about, which is, Black women aren't believed. They're not given a level of respect. It's just you're a patient and their expectations of what you're legally owed, what you're ethically owed. And then it turns out that this historic disdain that is intergenerational can result in someone like Miss Dawson, who should have been like a sympathetic character, if you will, if you're talking about this in legal speak, Black grandma. She should have been a person that they were sympathetic to, that they provided care for. And so anyway, I have a chapter that begins with Mrs. Dawson's story because I think then it helps to give us some sense then of what it means for pregnant Black women who go to seek medical care and what happens when they don't get what they're needing. And it's like a perfect case study of everything going wrong. And it turns out that systemically, there's a lot of everything going wrong when it comes to the treatment and care of Black patients.
Absolutely, that's a powerful story, and even getting into the implicit bias aspect, and so it's really important. And the kind of I want to move to Kishelle Webster, and you're on Capitol Hill, and as someone who's entrenched in Black maternal health federal policy, and so you're familiar with the various bills that have been proposed to advocate for Black women, along with Kira Johnson Act, and also Congresswoman Adams reintroduced the Maternal Care Act. And so could you elaborate on the Maternal Care Act and why this is so important?
Yes, absolutely. And I think Professor Goodwin and Dr. Joya really laid out, I think a perfect segue into why the Maternal Care Act is so important. One of the things that has been a theme of this conversation is that we're dealing with structural and systemic racism that needs to be broken down, and that there needs to be an entire sort of re-education that needs to take place, including within our medical schools, including with our hospitals, with our healthcare providers. And so one of the big things that the Maternal Care Act does, that Congresswoman Adams and Senator Gillibrand have reintroduced recently, there are two grant programs that are funded through the legislation. The first one, it's to develop these implicit bias training programs to re-educate the healthcare workforce, physicians, medical students, really taking it even back into medical schools. Because one of the things, and maybe Dr. Joy can even speak to this more eloquently than I, many physicians, OBs, nurses, they talk about the fact that even within their medical training, they are taught that Black people can tolerate pain greater than white persons and than other persons, that their skin is tougher, that there are these sort of fundamental differences, that are tied to race, which couldn't be further from the truth. But when those sorts of trainings are embedded within the medical profession, those things get perpetuated within the hospital setting, within the clinical setting. And we're seeing that care is being impacted by the fact that there are providers who hold these belief systems, right? Have these unconscious and conscious biases. I like something that Dr. Joya said earlier, perhaps we need to get away from implicit bias trainings and really call them birth equity trainings, and really need to look at this in a much more holistic manner. It's not just, well, this person maybe has a preference, or this is just how they were taught. really kind of breaking that down fundamentally. So that's one aspect of the legislation. And then the second part of the legislation is providing funding for pilot demonstration programs, specifically to help, at least for 10 states, to help them set up pregnancy medical home demonstrations, also known as kind of home visitation services. In North Carolina, where Congresswoman Adams is a member and she represents, we have found that our statewide pregnancy medical home program has been very effective in helping to bring the gaps in terms of the rates of maternal mortality between Black birthing persons and white persons. We've seen these medical home programs and these visitation programs really help to bridge that gap and close the divide. And so we would really, through these demonstrations, we would love to see that expanded more to other states where it's integrated into the overall sort of health infrastructure. And then the last little aspect of the legislation is a study that will be led by the National Academy of Sciences to really better understand how we design these training programs, birth equity, if you will, or implicit bias, really making sure that they're designed in a way that's effective. I think one big criticism that we've heard consistently is that some of these programs are just a one and done. It's not sort of a consistent, ongoing, re-education. And so we don't want this to just be a program where folks check a box, they look at a webinar and that's it. We really want this to be sort of an immersive, really transformational, type of paradigm shifting kind of program going forward. And so we're hopeful that, the academies can kind of help us with designing that. I know there are some universities who have done a lot of really great work and research in these spaces. And so that's just one aspect of the legislation. But, we are really hopeful that we can get that over the finish line this Congress as well.
And thank you. I mean, we definitely appreciate the hard work that you're doing on Capitol Hill. Is, being a former legislative director for Congressman Lewis, you definitely need the folks on the Hill sort of advocating and pushing for policy change. And I know we're getting close to time, but I want to also, as we talk about policy change, look at also the advocacy, and so pushing from the outside. And so we have Lexi White here, and we'd love to hear from you. You're one of the leading reproductive justice organizations leading the way in national, state, and local advocacy initiatives from a human rights framework. And would you please tell us more about the values within the reproductive justice movement and how that impacts the way in which you advocate for Black women?
Certainly, thank you, Tammy. First and foremost, I really want to continue to ground us in the reality that we are just now starting to climb out of both a health pandemic and an associated economic, recession, where Black women were overwhelmingly not only pushed out of the workforce, but subjected to the health impacts of COVID-19. Additional caregiving and caretaking responsibilities that have come with that, again, and economic hardships that have come from being pushed out of the workforce. And so, my call to action, and I know our audience is many lawyers today, is that we continue to need lawyers and lawmakers alike who are deeply committed to working with advocates who are contextualizing the Black maternal health crisis in the context of structural racism and gender discrimination, right? In the context of the ongoing political assaults on our access to standard basic reproductive health care that includes abortion care, and the hypocrisy of lawmakers who are making it their business to push abortion care out of reach, but not being active around making sure that Black women can have healthy pregnancies and raise healthy children in healthy communities when we embark on this journey around pregnancy and parenting. So that continues to be a key tactic in our work in highlighting that hypocrisy and help asking lawmakers to be bolder. You know, if you're not coming out in support of the full range of care options that we need, we absolutely need you to be vocal about making sure that we can have healthy birth outcomes and the basic social supports that we need. We absolutely need you to name and not be afraid of naming, both in your policies and in your advocacy work, that this is not a race problem, that this is a racism problem, this is an economic and gender discrimination problem. The other thing is that, you know, as advocates, you know, and movement builders, we are continuing to connect the dots across movements around the social and environmental realities that are at play. And that, of course, involves, as Congresswoman Alma Adams mentioned in her remarks, the environmental justice crisis that our communities face. And that includes barriers to things like access to clean air and water. We actually, in our most recent national poll, found that between 70 and 75% of respondents indicated that ensuring access to clean water alongside having access to jobs that pay a livable wage and jobs where equal pay is enforced, you know, would contribute to making it a better time to being a Black woman in America who is free to raise healthy children if she so chooses, right? And so we know that, you know, Black women are harmed at significantly higher rates by exposure to extreme heat temperatures, by heat island effect, proximity to industrial pollutants and waste that contribute to premature births, lower birth rates, childhood asthma, et cetera, and especially for folks who are already living with and subjected to pre-existing conditions, you know, related to structural racism. You know, 1 in 3 Black respondents on an earlier poll actually reported having had brown water come out of their taps at home. And 50% said that having access to clean water was a real factor at play in decision-making around pregnancy and parenting. So we have to continue to connect the dots here and to support policies at the congressional level. You know, obviously the Momnibus Act, I specifically also would like to highlight Congresswoman Underwood's protecting moms and babies against climate change legislation that's a part of this package. But to have these conversations together and to get lawmakers who maybe have been siloed around different issues to see these issues and to talk about these issues as interconnected as we work to expand programs that protect women's health, you know, and foster healthy programs, healthy pregnancies and postpartum outcomes across their lifetimes. You know, I think it's really important. I'd like to highlight the importance. I know, you know, this panel is certainly an expert around this, but also to our audience today, you know, we want to see the ending of coercive, non-consensual drug testing policies in settings that increase criminalization risks facing Black women and their children, and support family-affirming substance use treatment, you know, versus criminalizing substance use, in addition to ensuring that pregnant incarcerated folks are not shackled, that they have access to trauma-informed, you know, primary prenatal care, a range of birth options and postnatal care, in addition to access to seeing their children and being able to provide care support for their children. And, you know, to really leave a call to action, you know, with the lawyers who are watching this conversation today, we need you to be in community and to be in intentional relationship with community-based organizations and grassroots leaders, and to be thinking about how your role within shifting power, your role within helping to make sure that the lawmakers we are working with to champion this issue are in fact reflecting, you know, reflective of the communities who continue to be most impacted by maternal health disparities. And so we invite you to work with us and to really be intentional about building partnerships in the communities that you're working in.
Thank you, Lexi. And I know we're at time. I have one question. This has just been an awesome panel. Each of you have such a wealth and depth of knowledge. Wanted to just pose a quick question to whoever wants to ask, Professor Goodwin, Dr. Query, any of you. What else? I mean, Lexi, you spoke to this, but what can lawyers do in terms of addressing the maternal health crisis? Is there a call to action? Do any of you want to comment on that?
I'll be quick because I think Professor Goodwin's probably better at this. I just want to say that it's also not just federal, but it's local and state. A lot of the policies, a lot of you work inside of city, municipalities, with hospitals. I've had attorneys generals to call me to say, I want to make a policy around discrimination in hospitals because of this Black maternal health crisis that's happening. So that's happening around you. So you need to get engaged in your state and local policy, because this crisis around discrimination in childbirth is not just a federal crisis, it's also local and state.
And in fact, it's maximized at the state level, right? Because there are more people who are incarcerated at the state level than there is at the federal level. But I'd also say that this is a great space to be involved in pro bono. So if you're thinking about, where to volunteer your time, so many people who are caught into these systems who've had to take 10-year, there are people taking 20-year plea deals on cases that should just simply be tossed out, right? And if they actually had lawyers who'd be like, no, this makes no sense, here's how we build this case, there would be people who would be able to be reunited with their families. I think it's really important to understand the collateral consequences of the times in which we're in, so that it's not just affecting the Black women or the birthing people, but it's also affecting their families. If they become incarcerated because of taking a plea deal or something like that, their children are likely to end up in foster care or in some other kind of compromised position. And there's so much data that just shows how terrible in many ways that life simply can be, and families not able to be reunited. So it's a great question that you asked, Tammy. I wish that we have more time for this, but like Dr. Joya said, pay attention to the state level and volunteer. Please do pro bono work in this space. It's so important.
Great, thank you. And where can we find the Police in the Womb? And Joya, how do they sign on to your White House office on sexual and reproductive health?
You can find it at all major online bookstores, at Barnes & Noble, Amazon.com. If you want it in your local bookstore, just tell them to pick it up, but you can easily purchase online and from the publisher, Cambridge University Press, too.
Thank you.
If you go on birthequity.org, we have a site there for the White House Office of Sexual and Reproductive Health and Wellbeing. I hope you all sign up, because we deserve justice and joy.
And Cashel has placed in the chat for everyone that's interested, and we'll send it to you all, the legislation for the Black Maternal Health Omnibus Act and also the Maternal Care Act. We will email that out to everyone. And thank you very much to the National Bar Association for sponsoring this fantastic forum, and maybe we'll have a part 2. So thank you all so much for joining us today.
Thank you so much.